Hi there everyone, my name's Jay. I'm one of the occupational therapists from Auckland City Hospital. I just wanted to give you a guided tour of our occupational therapy kitchen. First, what we have here is a kitchen trolley. This is a type of equipment that we use to demonstrate to patients to allow them to move equipment and move utensils and their breakfast from the preparation area to their dining area. Next, we have a box with various types of utensils that we use with patients who have difficulty with feeding themselves. Take for instance this fork, which has a weighted handle that we typically use with patients with tremors. We have different types of handles that we use with patients that have various forms of difficulty with gripping their utensils. Also, we have utensils with right angles that we use with patients that have difficulty with range of motion.
Here we have the OT bathroom, which is shared by the 3 OPH wards. The idea is that we try and emulate home environments as much as possible. So if someone has a lip to get into their shower at home, we like to bring them here to practice that. And if they have a bath at home, we try and practice bath transfers with them. These are commonly prescribed pieces of equipment such as a shower stool to manage fatigue and to manage pain when showering, and transfer bench to aid safer transfers in and out of the bath because it's a time of high falls risk. We've got a bath bench on the side here, a bath board, sorry, and over toilet frame, which is one of our most commonly prescribed pieces of equipment. It has height adjustable legs and it has 2 handles that the patient can push up from.
Okay, so next we have the gym that we use in conjunction with the physiotherapist and any other parts of the MDT. Typically, we use this gym with the physiotherapist to conduct joint sessions. A lot of the equipment that we use here in the gym, including the plinth that we can use for functional activities like dressing, sit to stand practice. We have the treadmill here that we can also use. We have a ceiling track hoist that we typically use with patients that are stroke or just learning how to weight bear again after a hip replacement. They can also use it in conjunction with the parallel bars here. So just walking along the parallel bars, which provides that extra bit of support when they're learning to walk again. This line of chairs is used for when we have group classes, which are also done between the OTs and the PTs. Then the patients are all lined up and use the parallel bars to support themselves when they're doing sit-to-stand training. Other pieces of equipment here, we've got the exercycle, we've got the stairs here that typically the physiotherapists use for when patients have stairs at home that they have to negotiate, and a whole lot of other equipment here that we can utilize for hand therapy, upper limb training, and just functional activities as well, like the easy reach that you can see there. So now we're here on the ward. What we have here are typical moving handling devices that we use. The first one is called a Sara Steady, which assists patients to sit to stand. So typically the patient would be sitting on the bed, and we just get them to stand, and then it allows them to perch, and we can move the patient around. The next is the Sara Plus, which is a motorized standing hoist. The motor would assist the patient to stand. And the last one is a mobile hoist where the patient is unable to facilitate any standing or moving at that point in time. Here we have a hospital bed. As you can see from the buttons here, it is very adjustable. So the bed can go up and down, it can decline, recline, the headrest can go up, the footrest can go up as well. So it is adjustable just for the patient comfort and as well as aiding the therapist when they're doing their treatment sessions as well. We have a height adjustable chair. This is often adjusted to suit the patient's height to allow for safer transfers. Having it higher can make it easier for the patient to accomplish that sit to stand. After hip surgery, a patient may need to maintain hip precautions as well, so it has to be adjusted to a certain height as well. We've got a bedside table. And also we have a board here, a PSAG board, which can, at a glance, give the patient's status in terms of what they're able to do in terms of movement, their feeding, if they've got any hearing impairments, vision impairments as well, the nurse of the day, and any support persons they have as well.